Hi everybody, I am Leslie and I will be performing a dysphagia treatment on a pretend patient today. I will be doing bolus modification, so I will be helping her with her bolus volume, so the size of the bolus on the spoon, her bolus rate, and the sensory properties of the bolus. So for example, a sour bolus. Okay, so first we're going to work on controlling the bolus size. So I want you to take a bite for me, okay? Let's try a little bit smaller than that. About half of that, a little bit smaller. Let's try about half a teaspoon. So just from the very tip of your spoon. Okay, that looks good. So let's take that bite. Good. Was that easier to swallow?
Mm-hmm.
Awesome.
Yes.
Okay, so now we're going to work on controlling the bolus rate. So I want you to take 3 bites for me at the same size that you just took. Okay, wait. Before you take another bite, I want you to chew and swallow that.
Okay, I got it.
Let me see. Okay, good. So now you can take another bite. By waiting, you're not shoving all the food in your mouth, so it's not like you're going to have a whole mouthful and trying to swallow all of that. So if you wait and chew before you take your next bite, it'll make it easier.
That makes sense.
Okay. So I'm just going to watch you take a few bites. Did you swallow that one?
Yes.
Okay, good. Okay, so now we're going to try with a sour bolus and see if that makes it easier to swallow. So give me a small bite. Good. So we're going to add a little lemon juice to it. Okay. So now I want you to swallow it for me. I know it's sour, but did that make the swallow like tricky a little bit easier?
Did.
Okay. So now I'm going to put some gloves on and I want to fill your swallow with all 3 of these. Okay. So I want you to take a small bite for me. Good. Good fast swallow. Okay. So now I want you to take 3 bites, but taking time in between and making sure you're swallowing in between each bite.
Okay.
Good, I felt that swallow. Good, felt that swallow too. Good, I felt that swallow too. So now let me add the sour for the last one. Okay, and now let me fill this one. Good, a nice quick swallow.
Yes.
Okay, so now that y'all have seen the treatment, let's talk a little bit about it. So I found that candidates for bolus modification can really be any patient with dysphagia who wants to eat as normal of a diet as possible. So the choice and use of a specific treatment for dysphagia really depends upon the patient's underlying neuropsychological impairment and their specific swallowing deficit. So I found an ASHA website that said that the treatment for dysphagia may vary depending on whether it is a result of an acute event, whether it is a chronic or stable condition, or whether it is a progressive disorder. So, compensatory techniques can alter the swallow but do not result in a psychological or lasting change. The goal of a compensatory therapy or strategy is to improve the effectiveness and safety of the swallow so that the bolus can pass to the stomach without aspiration. So bolus modification is a type of compensatory strategy involving the patient's diet. Bolus modification can include changing the bolus size, the bolus rate, and the sensory properties of the bolus, such as a sour bolus. Bolus modification can be used to improve the swallow for a variety of patients, but is often employed when a risk of aspiration is present. So 2 articles that I selected provide an evidence base for bolus modification as a treatment for dysphagia. The first one I found is Dysphagia in the Elderly Management and Nutritional Considerations. This one is by Sura, Madhaven, Carnaby, and Crary. And the second one I found is Effects of Therapy in Oropharyngeal Dysphagia by Speech and Language Therapists, a Systematic Review. This one is by Speyer, Bashins, Heijnen, and Zwijnenberg. So in the first article, Sura and her colleagues in their article describe compensatory techniques as just simple adjustments that allow patients to continue their oral diet safely. So these changes are really intended to have an immediate benefit on functional swallowing and can really include changes in the posture, the swallowing maneuvers, and diet modifications. And in their article, they provide support for modifying solid foods to accommodate swallowing limitations for the elderly patients with dysphagia. So, a major goal in their article was to provide a diet that reduces the risk of malnutrition and pneumonia. So, in the second article by Speyer and her colleagues, it provides an extensive review of the literature comparing treatments and outcomes for dysphagia. So many of the studies reported had positive results of speech-language therapy that included these compensatory techniques like bolus modification for patients with swallowing deficits. So for example, in their article, one study reported significantly fewer cases of aspiration and pneumonia for patients who were treated with bolus modification.